Med history.
Plague, Black Death, is an acute disease caused by the bacterium Yersinia pestis. It belongs to the group of particularly dangerous quarantine infections. It is clinically characterized by the syndrome of general infectious intoxication, fever, damage to lymph nodes, the reticuloendothelial system, tissues rich in macrophages, such as microglia, lungs, and other human tissues. It is transmitted in various ways, of which airborne droplets are the most dangerous. Without adequate treatment, the plague can lead to death. Cases of use as biological weapons are described in the annals of the 4th, 8th centuries and by the Japanese in 1939 and 1942. The causative agent of the plague is the plague bacillus, Yersinia pestis, discovered in June 1894 in Hong Kong by Frenchman Alexander Yersin and Japanese Kitasato Shibasaburo. It was revealed that the plague microbe originated with a mutation of the bacterium pseudotuberculosis, or Y. pseudotuberculosis, no more than 20,000 years ago. For the first time, plague epidemics are described in the chronicles of the ancient world, mentioned in the Bible. Pathogenicity factors, substances that determine the ability of a bacterium to cause an infectious process. Plague toxin or mouse venom is a protein consisting of two fractions, A and B, different in composition and properties. It is extremely toxic to humans. Lipopolysaccharide endotoxin, consisting of a polysaccharide combined with a lipid. It is released when bacteria die. Y. pestis is able to break down carbohydrates and produces enzymes that help to colonize the body. Hyaluronidase, coagulase, hemolysin, fibrinolysin, pesticides. There are several subspecies of the plague pathogen, different in their ability to infect the body. Bacteria grow on conventional nutrient media with the addition of hemolyzed blood or sodium sulfite to stimulate growth at a temperature of 28 to 30 degrees C, pH 7.0, 7.2 with visible results after 14 hours. It contains more than 30 antigens. V and W antigens suppress immune reactions, in particular phagocytosis. The capsule protects the microorganism from dissolution by polymorphonuclear leukocytes, which control various stages of inflammation. The plague bacillus persists in the secretions of sick people and on objects of the external environment. In pus from the lymph node, up to a month. In the corpses of people and animals, up to 2 months. In the ground, under favorable conditions for several months. It withstands low temperatures. At 0 degrees C, it lasts for 6 months. In frozen corpses for a year or more. Does not tolerate the sun's rays, dies in 2-3 hours. Drying out, oxygen, high temperature. At 100 degrees C, plague bacteria die instantly. At 80 degrees C, after 5 minutes. A person becomes infected transmissively, through the bites of infected fleas, through contact with infected animals, contact with blood, meat, and skin of infected animals, and alimentary, when eating poorly cooked infected meat. Aerogenic infection occurs from patients with the pulmonary form of plague, airborne dust and airborne droplet pathways. The main way of human infection with plague is transmissible when the pathogen that is multiplied in the pancreas of a flea enters the human bloodstream during blood sucking. Transmission scheme: rodent, flea, human. The prevalence of the plague. In the 14th century, more than 50 million people died from the plague. In 2010 to 2015, 3,248 people fell ill with the plague. 584 of them died. The disease is most often found in Peru, the Democratic Republic of the Congo, and Madagascar. In the 21st century, plague epidemics do not occur. Only isolated cases are detected. On the territory of Russia, Astrakhan region, Kabardino-Balkarian, Ingush, Chechen, Karachay-Cherkess republics, Altai Republic, Transbaikalia, Dagestan, Kalmykia, Taiva. In neighboring countries, Kazakhstan, Mongolia, China. In the world, Madagascar, India, Vietnam, Africa, USA, India. In 1896, the plague reached the Indian city of Bombay and its surroundings. At the request of the authorities, Kovkin, an employee of the Pasteur Institute in Paris, arrived in Bombay in a short time. He developed a vaccine against the plague, the so-called Hodgkin's lymph. To prepare the vaccine, the plague microbe was grown in meat broth, and the resulting culture was inactivated by heating for an hour at a temperature of 65 degrees C. The administration of Hodgkin's lymph to rodents protected them from the plague, and the blood serum of these rodents protected them from infecting other animals. For a small anti-plague laboratory was established in Bombay to produce the vaccine. Symptoms of the plague. The incubation period for infection from a flea bite and contact with infected material lasts from 3 to 6 days. In case of aerogenic infection with the pulmonary form, 1-2 days. In vaccinated patients, this period stretches to 12 days. The vaccination lasts for about a year, providing relative protection. Then, for a short time, the disease develops in a milder form, at the end of the period, as in the unvaccinated. Plague often occurs in moderate to severe forms. The disease begins acutely, suddenly. Symptoms of the disease: high temperature, amazing chills, fever, intoxication, weakness, aching muscles and joints, severe headache, increasing anxiety, clouding of consciousness, a state of delirium, increased motor activity, senseless erratic running, dry mouth, thirst, nausea, vomiting in dynamics, with blood, white plaque on the tongue, abdominal pain, diarrhea with blood, puffiness of the face with an expression resembling a mask of horror and suffering, enlargement of small blood vessels visible visually. With the development of the disease, excitement is replaced by apathy and adynamia. A rash appears on the skin, pronounced tachycardia, cardiac arrhythmia, a progressive drop in blood pressure. Rapid, shallow breathing, tachypnea, develops. The amount of urine excreted decreases up to anuria. There are 4 clinical forms of plague: cutaneous, bubonic, primary septic, and pulmonary. Stages of the disease development. In the mucous membranes of the respiratory tract, a specific reaction, primary effect, occurs to the introduction of the plague pathogen in the form of a bubble with bloody contents, sometimes an ulcer. There is a primary reproduction of the pathogen and migration through the lymphatic vessels. The microorganism multiplies in nearby lymph nodes for 2-6 days. The condition is accompanied by a pronounced inflammatory reaction. Lymph nodes enlarge, stick together, partially melt, and form a bubon, conglomerate of inflamed lymph nodes. In the absence of antibacterial treatment, at this stage, lymph node necrosis occurs and microbes break into the bloodstream, bacteremia, with contamination of organs and tissues. The development of plague sepsis is possible, the appearance of many foci of bacterial accumulation, the formation of new bubones. The global spread of endotoxins is accompanied by the release of a large number of pro-inflammatory mediators, which leads to impaired microcirculation, the development of DIC syndrome, acute renal failure, collapse of the immune system, and infectious and toxic shock. Complications of the plague. DIC syndrome leads to the appearance of bleeding, the formation of blood clots in organs, and as a result, to multiple organ failure and death. Gangrene of the skin, fingers, and feet. The formation of blood clots in the vessels of the skin and extremities leads to tissue necrosis and the development of gangrene. Meningitis, inflammation of the membranes of the brain, is a rare complication. Plague patients are subject to mandatory hospitalization in specialized medical institutions. Idiotropic antibiotic therapy with streptomycin, tetracycline, rifampicin, and fluoroquinolones is used for treatment. Hyperimmune horse anti-serum is also used. Preventive measures. When a patient is identified or suspected of the disease, quarantine is introduced, restriction of contacts of an infected or suspected person, and isolation of an epidemic outbreak. The patient and those around him who are feverish are hospitalized. Persons who are suspected to have been in contact with the patient are subjected to preventive treatment and immunized with a vaccine that allows them to obtain a protective level of immunity a few days after vaccination. If necessary, revaccination is carried out. Well-organized vaccination reduces the incidence by 10 times. They organize active rounds of the population to identify and hospitalize feverish patients. Final disinfection is carried out in the hearth with the help of disinfectants. The outbreak of the plague in Madagascar. Annual immunization with live anti-plague vaccine of employees of specialized services and persons living or traveling to dangerous regions. Measures of non-specific prevention on a national scale include epidemiological surveillance of natural foci, control of the number of rodent vectors, control of persons living in endemic territories, sanitary and educational work.